Hi, perhaps you recognize me. It's your favorite YouTuber who's also a cardiologist that also lives in London. I hadn't planned on making a video about Donald Trump's recent illness because, as is often the case, I didn't think I had anything much to add. My friends Dr. Mike and Zubin Damania made excellent videos over the last few days on the topic. There's been loads written about it as well. But then the night before last, the president released a video of his own, which really shocked me. It was quite incredible. So I wanted to give a slightly different angle and a few quick thoughts, which aren't really even about the president at all, but about how we practice medicine itself. There's been a lot of talk and speculation about the US president's health in the last few days. Much of that has come from doctors, all too ready to give the world their hot take. My approach up till now has been exactly the same as when our own Prime Minister was in hospital with COVID a few months ago, namely to steer well clear. I understand the temptation to try to analyse things when someone so important is unwell, but I don't think it's a good idea to make guesses based on incomplete information. However, the therapies given to the President by his medical team are surprising. And I'll explain why, even though I might disagree with what his physicians did, I may well have ended up doing exactly the same thing, and I certainly don't envy their job. The drugs that have been mentioned are an experimental monoclonal antibody cocktail from a company called Regeneron, an antiviral called remdesivir, the steroid dexamethasone, zinc, vitamin D, and some other stuff like aspirin and so on. We learnt that while he had been taking hydroxychloroquine, as he said on several occasions, for a while, it appears that he has stopped, or he stopped before coming to hospital. Prince Philip, the Queen's husband, had a heart attack a few years ago and was brought to my old hospital. Now, do you think they would have let a chump like me, still wet behind the ears from medical school, do his case? Of course not. In fact, there were several consultants present instead of the usual one. When I was doing my PhD, I worked as a general dog's body at one of the top private cardiac hospitals in London, and met all manner of VIPs and celebrities from all over the world. And I wish I could mention some to you, but having a famous patient is kind of like cheating on your wife with a Victoria's Secret model. You really want to show off, but you must never tell anyone. The point I'm trying to make here is, do VIPs get the same treatment as us regular folk? No, of course they don't. But does doing more always mean doing better? I don't just mean giving more medicines, but running more tests, doing more scans, and so on. It feels like this is giving the patient better care, but just take a look at my screening video to understand why doing more testing and more personnel around is usually not better for the patient. And in reference to who does an operation, it may feel natural to want the most experienced doctor to do it, but he may spend most of his time in conferences or lecturing or in meetings, whereas his registrar, she's operating day in, day out, leading to the famous line in medicine, "Never let the prof do your operation." Don't just do something, stand there, is another well-known adage in medicine, alluding to the fact that a lot of medical practice is doing as much of nothing as possible to the patient and allowing them to heal themselves. And remember, COVID-19 has claimed 1 million lives worldwide, but the vast majority of people recover on their own with no medication. So if you look at that long list of treatments that the president was on, you might think that the patient is on death's door. If somebody critically unwell is in intensive care and looks like they're losing the battle, no one would criticize you for adopting an approach we refer to as the kitchen sink. Hit them with everything you've got nothing to lose. But that wasn't the case with Trump. We know now that he was in hospital 4 days and he's back at home, he's feeling better, he's actually about to hit the campaign trail. In which case, taking the kitchen sink approach is risky, even more so when the therapies are unproven. We don't actually know if they work. We don't know what their side effects are. None of these drugs will have been tested in combination with all of the other ones. We don't know how they interact. If you or me had been admitted with the same symptoms as Trump, I really doubt we'd have got the same combination of therapies and would probably have been better off. The reason I sympathize with Trump's doctors is that it's tremendously hard to just stand there and not do something. This is called commission bias, the compulsion to act. If Trump had died, the world's media would have leapt on his doctors, accusing them of standing by and letting this happen. No amount of explanation about evidence-based medicine would have calmed the flames or the inevitable civil war. Trump thankfully recovered and made this really quite shocking video the day before yesterday where he extols the virtues of Regeneron's cocktail on several occasions.
I went in, I wasn't feeling so hot, and within a very short period of time they gave me Regeneron. It's called Regeneron, and other things too, but I think this was the key. But they gave me Regeneron, and it was like unbelievable. I heard about this drug, Regeneron. I said, let me take it. It was my suggestion. I said, let me take it. And it was incredible the way it worked, okay? I call that a cure. It's a cure. For me, I walked in, I didn't feel good. A short 24 hours later, I was feeling great. I wanted to get out of the hospital.
Incidentally, does anybody else think of this when they hear the Regeneron cocktail? Maybe it's just me. So why is this so problematic? Because before we run a randomized controlled trial, we need something called equipoise, where the clinicians and ideally the public maintain neutrality on whether a therapy being tested is effective or not. If we're bombarded with interviews from the Regeneron CEO or people from Eli Lilly, who the president also mentioned because they've got a similar antibody-based product, making unevidence-based claims, or we read articles about its biological plausibility, which is a term that's always bandied about by pharma companies in the early phases, but that has foreshadowed the demise of thousands of abandoned treatments that were eventually shown to be useless. If we hear the President of the United States saying with complete conviction that it was the Regeneron cocktail that saved him, then equipoise is lost. Of course, the President's assertion ignores the fact that he probably would have recovered without it anyway. He was on multiple treatments, what we call polypharmacy. So there's no way of knowing what worked and what didn't. And I can't stress this enough, you cannot prove anything from a single case anyway. Remember this next time Karen says it was going gluten-free that cured her arthritis, or Chad says going carnivore cured his diabetes. Losing equipoise means doctors will subconsciously alter their behavior, like biasing who they enroll or acquiescing to patients' demands to be on the drug, thus losing any chance to actually prove that it works. Because of course it might. I'm not saying Regeneron's cocktail doesn't, but without equipoise and a proper randomized controlled trial, we won't know. And who will want to enter a randomized controlled trial if there's a 50% chance you won't get the apparent wonder drug? I don't want to be in the control arm. I want that expensive cocktail that cured President Trump. I can't help but feel that the increasing role of tech in our lives has shaped how we view new medicines. Nowhere blends business and health as much as in the US. But instead of boring scientific papers announcing results, we've got Apple event-style launches of medical interventions and biotech CEOs pacing up and down on stage saying, "Thank you for coming to my med talk." Remember, drugs aren't iPhones. Medicine isn't Silicon Valley. New isn't always better. Stop worshipping at the altar of novelty. Stop interviewing CEOs. Stop interviewing cheerleading doctors who are on their payroll. People look back at Theranos and ponder, how did we let that happen incredulously? But it's happening again right now. Elizabeth Holmes was lauded as a savior and visionary, and everybody bought into the hype. Hype should not be a word that exists in the medical lexicon. Medicine should be a hype-free zone. 9 out of 10 doctors recommend avoiding hype. Have you noticed an increase in hype-related thoughts recently? Uncontrollable blood pressure? You might have hype-attention. If your doctor offers you hype, just say no. I still get dozens of comments about vitamin D and hydroxychloroquine every day, so I'm going to quickly address those as there are a few updates. Hydroxychloroquine has not been shown to have any beneficial effect. John Ioannidis, who has been a prominent voice against measures like lockdown, so hardly someone that can be accused of towing the line, and his team just published a large meta-analysis of hydroxychloroquine, which confirmed its lack of efficacy and even suggested a net harm from its prescription, strongly advising its use is not supported. The New England Journal of Medicine just published the final recovery trial results as well, again showing evidence of harm. Hydroxychloroquine believers feel that the reason doctors like me don't want to support it is because it's cheap and we've been paid off by big pharma to promote expensive medications that will make the most money. So then I really should be firmly behind Regeneron and remdesivir. Yet when an equally cheap and old off-patent medication, regular old dexamethasone, which stands alone amongst all the meds I've mentioned in this video, is the only one having a clearly demonstrated sizable beneficial effect on survival, not some surrogate marker like days in hospital, was shown to be our first real weapon against severe COVID, none of these people were interested. I guess there was no conspiratorial angle or maverick French scientist going against the grain, just a brilliant joint effort from hundreds of clinicians coordinated by Oxford and the National Health Service here in the UK. And yet here is the president promoting an extremely expensive, unproven treatment. So I keenly await to hear what the anti-medicine group have to say about this. Vitamin D has been shown time and time again to be correlated with poor outcomes in pretty much any disease. People with low vitamin D levels tend to do worse. But you know where I'm going with this. Correlation is not causation. This is not a causal link. Frail people go outside less because they're frail. This means they get less sun and their vitamin D levels are low. It doesn't mean the sun is protecting them from anything. It's just a reflection of their baseline state. If you don't believe me, ask yourself why every single trial that has replaced vitamin D with supplements found no benefit. But people feel very strongly about this, and vitamin D or zinc are pretty harmless over-the-counter supplements, so I'm not going to get too upset if people really want to take them. Remdesivir has an emergency use authorization as well, and yesterday the New England Journal of Medicine published the final results of a trial looking at remdesivir, which was not funded by Gilead, unlike previous results. It showed no mortality benefit, but slightly improved recovery time, which is reminiscent of Tamiflu, oseltamivir, which was widely adopted as treatment for flu epidemics and continues to be extremely widely prescribed despite its pretty modest benefit. There were a couple of other notable revelations in the video, the first being Trump confirming what we all pretty much knew, that a vaccine won't be ready before the election. The second being a much bigger surprise.
And if you're in the hospital and you're feeling really bad, I think we're going to work it so that you get them and you're going to get them free. I want everybody to be given the same treatment as your president, because I feel great. I feel like perfect. So I think this was a blessing from God that I caught it. I want to get for you what I got, and I'm going to make it free. You're not going to pay for it.
Well, you heard it from him directly. Trump is now in favor of giving what he sees as life-saving treatment to people for free. We're going to make some beautiful antibodies, and China is going to pay. As COVID kills far fewer people than cardiovascular disease and cancer, I can only assume he's also going to be in favor of proven therapies for them as well, for free. So if you had Donald Trump promoting socialized medicine on your 2020 bingo card, I salute your foresight. Actually, in that case, can I ask you, who do you have for the election?